According to Johns Hopkins University, as of 1:30 p.m. Eastern Time, December 22, 2020, there are nearly 78 million global cases and close to 2 million deaths due to COVID-19. But how did all of this happen? Back in 2019, there was the discovery of a new virus that first emerged in the market in the city of Wuhan, China. This virus is called the Severe Acute Respiratory Syndrome Coronavirus 2, or what most would call coronavirus, that causes the disease COVID-19. This virus belongs in a large group of viruses called coronaviruses, named after their characteristic crown of club-shaped spikes around its surface. They spread around animals like cats, birds, and fish, but can also evolve, infecting people. COVID-19 is most commonly spread through respiratory droplets, say when a person coughs or sneezes, or when a person touches an infected surface and then touches their eyes, nose, or other parts of their face. Transmission occurs most often when in an enclosed space where people are close to each other. From there, the virus enters deeper inside of the body until it reaches its destination, the lungs, intestine, or spleen. Once it arrives, the virus's protein spikes bind to the host cell, injecting its genetic material, causing the healthy cell to continue replicating more viruses until it self-destructs, leaving the body with only more virus cells. In a matter of days, the body becomes swarmed by billions of virus cells, causing fever, cough, fatigue, difficulty breathing, generally beginning 1 to 14 days after exposure. While most symptoms are mostly mild, some individuals develop ARDS, acute respiratory distress syndrome, which can be followed by multi-organ failure and septic shock. The virus can also cause long-term damage to the heart and lungs. This easily contractable virus has been a burden to healthcare workers as hospitals worldwide become overwhelmed by the increasing number of patients, converting chapels, cafeterias, waiting rooms, hallways, even a parking garage into patient treatment areas. Other than the physical impacts, the virus has equally affected the economy, caused by a significant decrease in demand by consumers. This is particularly seen in the travel and tourism industry, since many countries around the world have placed restrictions on travel. As a result, employment or staffing was decreased to cut costs. But, as unfortunate as it may seem, there have also been sectors that have thrived during this period, such as e-commerce, food retail, and healthcare. With all that said, the coronavirus has changed the way we live our daily lives, as policies and public health measures have been created to contain it. These include the transition of in-person schooling to online learning, wearing masks indoors, and banning social gatherings. All of this ends up affecting our mental health. This pandemic has caused anxiety as well as fear among many people due to the uncertainties linked to personal health, employment, financial stress, and the inability to connect with others frequently to reach for support due to social isolation and regulations. Luckily, with great effort, the Pfizer-BioNTech, the first vaccine against the virus that gained authorization in the US, was on December 11th. Next was the Moderna vaccine on December 18th. Yet, even with the recent development of a vaccine, it may still take a while before the end of the pandemic. With a limited number of COVID-19 vaccines distributed around the world, countries debate on whether healthcare workers and long-term care should receive the vaccine first, or for those who are most likely to spread the virus, which include people working in the community. With that in mind, we need to continue our efforts to not getting infected while not infecting others. Although it may sound obvious, soap is extremely useful against COVID-19. The coronavirus is surrounded by a lipid envelope, or a layer of fat. Soap breaks that layer apart, making the virus unable to infect you. The next measure to take is to wear masks. A mask or face covering can prevent the spread of respiratory droplets and infection to others, slowing its transmission. Finally, people need social distancing. This would mean no close contact, like hugging or handshakes. Although difficult, this pandemic is in our hands and depends on our individual actions to end it. We may not be at that finish line yet, but there's still hope that someday we may return to the ways we used to live.